Hi everyone, Dinesh Sarasen here, and today we're going to be talking about injections into the knee joint. So as with my previous video about imaging the knee joint, I recommend having the patient in a supine position with something underneath the knee to stabilize it so that it's flexed to 90 degrees. This will be much more stable when you're undertaking imaging as well as when you're performing the injection. So when undertaking the injection, I usually adopt one of two approaches. Firstly, you can do the injection into the suprapatellar bursa, either from a medial or lateral approach, or you can do it into the retropatellar space. The suprapatellar bursa injection is particularly useful if you find that there is an effusion on ultrasound, in which case you can guide the needle into the bursa, drain the fluid, and inject at the same time. The retropatellar approach is more useful if there isn't an effusion and perhaps there is significant degenerative changes or the suprapatellar bursa isn't particularly evident when you look at it in a short or long axis. In both situations, you can use a 23 gauge needle, and this should be sufficient for most injections that you're going to put into the knee, including PRP, hyaluronic acid, and steroid. And this is what you'll see on ultrasound. So if you're going for the suprapatellar bursa, you will see the quadriceps tendon with the fat pads around it, and you should see a fluid space if there is an effusion, or if there's not, it may be sat down upon the prefemoral fat pad. In this case, you might want to come in from a medial or lateral approach to guide the needle into position. For the retropatellar injection, you can do this from a medial or lateral approach, but I recommend from a medial approach because the space tends to be a little bit more accessible than from the lateral approach. In both situations, it's good practice to aspirate to make sure that you haven't damaged any vessels, and then you're free to perform the injection. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below, subscribe to the channel, and share the video with your friends and colleagues. You can also follow me on Twitter and Instagram, and remember to check out sportsmedinfo.sg. Thanks again for watching, and I hope to see you all very soon.